Hello, I'm Dr. Jason Sutherland, a family doctor in Sudbury. As a physician, I have an interest in the health of all Northerners, and I'm committed to reducing the impacts and number of cancer-related deaths through our cancer screening programs. Too often, patients put off cancer screening. We hear patients say, "I feel well. Why should I worry about cancer screening?" Today, my message to you is simple. It's time. It's time to put your health first and to say yes to cancer screening. Cancer screening is testing done on people who may be at risk of getting cancer, but who have no symptoms and generally feel well. Screening can help us find cancers when they are small, less likely to have spread, and more likely to be treated successfully. Let's take a closer look at cervical cancer and the importance of screening. According to the Ontario Cervical Screening Program, compared to other cancers, cervical cancer is more common in younger people, with the highest rate occurring in women ages 40 to 59. The rate at which people in Ontario develop and die from cervical cancer has decreased dramatically in the past few decades. This is almost entirely due to screening. Cervical screening is done with a Pap test, which detects changes on the cervix that are most often caused by a human papillomavirus infection, also known as HPV. The cervix is part of the female reproductive system. It's the part of the body that connects the uterus to the vagina. In Ontario, it is recommended that anyone that has ever been sexually active and has a cervix be screened for cervical cancer with a Pap test every 3 years. Ontario is introducing a new cervical screening test that is better at finding HPV infections, which are the cause of almost all cervical cancer. With a newer test, screening won't be needed as often, and for eligible people who are not immunocompromised, starting at age 25 is recommended. Talk to your family doctor or nurse practitioner about the right time for you to start screening. I have found that it's very common for people to have questions about whether they should be screened for cervical cancer. Let's take a closer look at some of those questions. Should I be screened for cervical cancer if I feel healthy and have no symptoms? I am no longer sexually active. I have only had one sexual partner. I am in a same-sex relationship. I have been through menopause. I have no family history of cervical cancer. I've had the HPV vaccine. It may be surprising to learn, but the answer to all of these is yes, you should. The benefits of cervical screening definitely apply to you. Transmasculine and non-binary people who have a cervix should be screened for cervical cancer too. Anyone who has had their cervix removed by surgery should check with their doctor or nurse practitioner about continuing with screening, as some may no longer need to. People who were born without having a cervix do not need to go for screening. Other people who don't need screening include those who have never been sexually active or have reached age 70 and have had 3 normal Pap tests in the previous 10 years. During the screening test, a healthcare provider uses a medical tool called a speculum to open the vagina and examine the cervix. Using a soft brush, they will take a sample of cells and send them to the lab to be checked for changes under a microscope. Most people have normal results from screening. If cell changes are found, further tests could be needed and your provider will make any arrangements. It's important to remember that Pap tests are effective, but they are not perfect. Sometimes abnormal cells can be missed. It is important to go for regular Pap tests to lower any chance of missing changes. If you have unusual vaginal bleeding or discharge, see your healthcare provider even if your last Pap test was normal. Don't forget there are other ways to reduce the risk of cervical cancer. Most important is to consider HPV immunization. The HPV vaccine is available free of charge to grade 7 students through school-based programs. The vaccine prevents most, but not all cervical cancers. When possible, being vaccinated before becoming sexually active will reduce the possibility of HPV infection. In some cases, older people who are already sexually active may want to receive the vaccine. However, there may be a cost. Also, be tobacco-free and avoid secondhand smoke. Tobacco use can weaken the immune system, which makes it difficult for your body to fight off an HPV infection. It's time. Book an appointment with your doctor or nurse practitioner to discuss the right screening at the right time. For more information, go to www.hsnsudbury.ca/cancer screening. Please consider sharing this video with your friends and family. They too may benefit to hear that it's time for cancer screening.